Good morning. My name is Melina Moya, and today we are going to talk about long-term outcomes of partial oral treatment in endocarditis. Definition. Endocarditis is a rare and potentially fatal infection of the inner lining of the heart, the endocardium. This occurs when germs from elsewhere in the body enter the bloodstream and then attack in the lining of your heart valves at first. Infective endocarditis causes vegetations on the valves, produces toxin and enzymes that kill and break down the tissue to cause holes in the valve, and spreads outside your heart and blood vessels. Let's see this video about endocarditis.
Bacterial endocarditis is an infection of the inner lining of the heart or endocardium. The native heart valves are common sites for bacteria to infect, but non-valvular areas are also susceptible to infection as well, such as implantable devices or prosthetic valves. The infection usually starts when bacteria enters the bloodstream, then subsequently attaches to the endocardium. Some people at risk for infection are those who have pre-existing heart disease, such as in people with extensive cardiac surgery, people with a history of mitral valve prolapse, or in people with congenital heart diseases. People will present commonly with fever. They may have a new murmur, and even cutaneous manifestations on the skin of their hands and feet. A neat way to remember the common signs and symptoms of infective endocarditis is to remember the phrase from Jane, where F stands for fever and is the most common finding. R stands for Roth spots, which are these white lesions surrounded by hemorrhage on a fundoscopic exam. O stands for Osler nodes, which are these painful immune complex depositions on the pads of their fingers or toes. M stands for a new cardiac murmur. J stands for Janeway lesions, which are these painless lesions on the palm or sole. A is for anemia. N is for nail bed hemorrhages, also known as splinter hemorrhages. E is for emboli, because these patients are at risk for developing septic arterial and pulmonary emboli as a result of the infection. Your patient may not have all these signs and symptoms, but it's helpful to group these ones together because they're often a favorite on exams and many standardized tests.
Now, the applications in medicine. Remember, endocarditis can be life-limiting. Once the patient gets it, it will need to be treated quickly to prevent damage to the heart valves and more serious complications, such as multi-organ sepsis, heart failure, and stroke. An infective endocarditis is typically treated with intravenous antibiotic therapy for up to 6 weeks. It's important to use a broad-spectrum antibiotic to cover as many suspected bacterial species as possible. However, there has been increasing recent interest in oral antibiotics as an alternative to prolonged parenteral therapy, not limited to treatment of infective endocarditis. Let's see this video about infective endocarditis.
Infective endocarditis is infection of the endocardium, the inner lining of heart chambers and the covering of heart valves. Infection is caused by microorganisms, mainly bacteria, that have managed to enter the bloodstream. Except for rare cases caused by massive blood infections or highly virulent organisms, a healthy heart is usually resistant to infection. This is because bacteria do not easily adhere to the surface of an intact endocardium. Constant flow of blood also helps prevent bacterial attachment, and the bacteria are usually destroyed by the immune system before they can cause infection. An abnormality of the endocardium is typically required for endocarditis to occur. Major risk factors include having prosthetic valves or other intracardiac devices, congenital heart defects, heart valve disorders, hypertrophic cardiomyopathy, and previous endocarditis. Endothelial injury allows for either direct colonization by virulent organisms or the formation of blood clots, which then become the attachment site for bacteria. Infection of the endocardium occurs most often on the left side of the heart. Organisms that cause endocarditis may come from distant infected sites, such as skin abscesses or urinary tract infections, or they may enter the body through a contaminated central line or injection. Bacteria of the normal flora of the mouth can also infect the endocardium if they get into the bloodstream, such as during invasive dental procedures. Causative organisms may vary depending on the source of infection, but streptococci and staphylococci are responsible for the majority of cases. Vegetations formed by bacterial growth may cause heart valve dysfunction, which can be heard as murmurs and may lead to congestive heart failure. Myocardial abscesses and tissue destruction may lead to cardiac conduction problems. Pieces of bacterial vegetation may break free, forming so-called emboli. Emboli travel in the bloodstream and may block arteries. Right-sided infections produce emboli that travel to the lungs, causing pulmonary infarction and respiratory symptoms. Left-sided infections can send emboli to any other organs, including the brain, kidney, spleen, and the heart itself. Tiny emboli may also travel to the skin and eyes, producing small red streaks under fingernails, on fingers, toes, and the whites of eyes.
Now let's talk about pros and cons. About pros, the use of partial oral treatment can minimize the challenges associated with outpatient parenteral treatment, including with intravenous catheters such as bleeding, local and systemic infections. Oral treatment allows to reduce hospital stays and costs. And partial oral antibiotic treatment is as effective as complete intravenous treatment, as long as we are dealing with patients with left valve infective endocarditis who were in clinical stable condition and with adequate gastrointestinal absorption. Let's talk about the cons. Even though it is safe to complete the treatment of highly complex endocarditis with oral treatments, many patients should be closely monitored because their readmission rate is high. Prolonged hospital stays are associated with a greater psychological and physical burden compared to shorter lengths of stay. It is not safe to apply partial oral treatment therapy in elderly patients who are fragile and have serious coexisting conditions. Now a video explaining this.
Patients with infective endocarditis on the left side of the heart are typically treated with intravenous antibiotic agents for up to 6 weeks. During the initial phase of hospitalization and treatment, patients often require intensive care and close monitoring. After this period, many patients remain hospitalized to complete intravenous antibiotic treatment. In this randomized non-inferiority trial, 400 adults in stable condition who had endocarditis on the left side of the heart caused by Streptococcus, Enterococcus faecalis, Staphylococcus aureus, or coagulase-negative staphylococci, and who were being treated with intravenous antibiotics were randomized to continue intravenous treatment or to switch to oral antibiotic treatment. In all patients, antibiotic treatment was administered intravenously for at least 10 days. The primary outcome was a composite of all-cause mortality, unplanned cardiac surgery, embolic events, or relapse of bacteremia with the primary pathogen, from the time of randomization until 6 months after antibiotic treatment was completed. In the intravenously treated group, the primary outcome occurred in 24 patients, as compared with 18 patients in the orally treated group, with a between-group difference of 3.1 percentage points that met non-inferiority criteria. This trial showed that in medically stable patients who had endocarditis on the left side of the heart, caused by Streptococcus, E. faecalis, S. aureus, or coagulase-negative staphylococci, a transition from intravenously administered to orally administered antibiotics was non-inferior to continued intravenous antibiotic therapy. Full trial results are available at nejm.org.
Now let's talk about issue applied in Ecuador. In Ecuador, infectious endocarditis is a rare condition and can get worse, producing big consequences and even death. The current medical challenge is to identify the correct antibiotic therapy selection and its duration to obtain a good response and clinical evolution. A recent study in the Armed Forces Hospital in Loja determined that infective endocarditis is more common in older people, with more than half of all cases developing in people aged over 60 years. The most common bacteria that can cause an infective endocarditis in Ecuador. In first place, Streptococcus, then Staphylococcus aureus and Epidermidis, and Enterococcus, which the Ecuadorian population are exposed normally. In conclusion, several studies affirm that in patients with endocarditis on the left side of the heart who were in stable conditions, changing to oral antibiotic treatment was non-inferior to continued intravenous antibiotic treatment.